depression can be caused by changes in certain neurochemicals like norepinephrine and serotonin. And there are a variety of ways of trying to bring those chemicals back into the right balance. Even when you give a medicine, you're changing brain chemistry. We're actually doing the same thing with electroconvulsive therapy, but in a different way.
Zucker-Hillside Hospital is at the forefront of electroconvulsive therapy. We have one of the largest programs in the area. We train doctors internationally. They come here to learn from the expertise of our physicians.
The program has a deep, rich history, has evidence of extraordinary outcomes. Being able to have treatments for someone who has not responded to any treatment, and the lives that we've been able to impact in such a positive way, that's what we cherish here.
ECT has been so portrayed in a negative way in the media that many people don't understand it. It's actually very safe and very effective.
ECT is really one of the best treatments that we have. The patient, number one, is not awake for the procedure, which is a common misconception.
If someone's suffering from major depression, they're started on an antidepressant. It could take 6 to 8 weeks for that antidepressant to kick in. They might not be able to tolerate the side effects. When you have ECT, you might have a side effect of a mild headache for an hour or so afterwards. If you feel better after 3 treatments, that's a treatment option that really works for you.
The important thing is to recognize that there are electrical pulses in the brain ordinarily. We're just trying to change the way cells are communicating with each other to overcome the dysfunction in the way the brain is working.
Our goal was to design and to invest in one of the most robust ECT programs in the country. And it was important for us to create a setting that people would be comfortable to come to.
The ECT suite is beautiful. It's spacious. There's a very large reception area for the patients and their families. There's a consult room where the patient and the family can ask the doctors any questions before the treatment. We have 3 treatment bays and 5 recovery bays. It is so much in demand right now that we've recently expanded our program to evening ECT. So our ambulatory patients go to work during the day, they come here after work, they have their treatment, they go right back to work the next day.
The nurses provide the true support structure for patients that are undergoing maintenance ECT on an outpatient basis, and for those who are beginning their ECT treatment while they're inpatients here.
There is a nurse at the bedside from the minute the patient comes in to the minute the patient leaves the unit. Each patient has their own nurse assigned to them.
When you see someone who hasn't responded to other types of treatment, but then has a good response to ECT, it can be quite dramatic.
I've been there for many years and I've seen the result of ECT is tremendous. It's just great.
There are many patients who have come to view this treatment as really life-saving. If this is helpful to people and can restore them to normal everyday life, that's what we want.